Hi, my name is Dr. Tony Weaver. I am an internal medicine physician practicing with U of L Health. So the reason I became a doctor, I teach medical students, and almost every medical student who wants to be a doctor, it's a combination of love of science and love of people. There is something there that makes you want to do that. I had one unique thing about me being a doctor. I came from a small town that was not particularly a wealthy town, and I wanted to bring some of the medicine that I saw in the big city back to a small town. I'm an internal medicine doctor, which is anything that doesn't involve surgery and affects adults. So if you've got problems with your blood pressure or your cholesterol or you're depressed, you would come to me first and we will try to sort things out together. I love problem solving because that's really what we can do to try to help people. So that's a big thing for me. The other thing is I've focused almost my entire career on older adults, and I find I really like taking care of senior citizens. You have to really have different approach to people who are older because they carry a lot of chronic illnesses, and the other thing is you can't fix everything completely. So in that sense, my goal is to try to give them the greatest happiness for the greatest period of time, fixing some things and then watching other things. Ultimately, it starts with love. You've got to love your patient. If you love your patient, then everything else falls into line. So the thing that I do is I try my best to love my patients, to care about them, to suffer with them when they're in pain, and to celebrate their triumphs. And then I also have a knowledge of medicine that I can use to help them to limit the pain and improve the quality of life. The older patients that are here in a small town, they don't want to go to a big city. They're frightened of driving there. They have to be back before dark because especially for them, driving after dark is a very risky proposition. So if we can provide them Louisville quality medicine here in their own small town close by, then we're winning. The other thing is you have to have doctors as a part of your community. They're going to be looking out for the health of the community. What are we doing about cigarette smoking in our community? Are we vaccinating our children? Are we taking care of people? Do we provide them with green space for exercise? These are not decisions that you can make from a mobile van that comes out of a big city. They have to be made locally. For me, teaching has always been a passion. And that involves teaching the community or teaching my patients or teaching the next group of physicians. I absolutely love doing that. And one of the ways you do that is you bring out the things in medicine that are exciting and the things that are on the forefront, the research that people do. I love reading medical research. I do it pretty much every day. That's the first thing I do when I get up is I check the headlines to see what new articles have been published in the journals. I have a farm which I raise cane, basically. And nothing else. We do have a horse, and I love working outside on my farm. I like hiking and outdoors when I'm not in the office.